5.
Hi there, I'm Barbara Hamilton and I'm an interventional radiologist, and I was asked by our friends at Surgery Girls to make a video on the proper donning of a surgical gown and gloves. So if this is your first time in an operating room as a medical student, or if you're starting your residency, you don't need to feel dumb. You can watch this video and maybe it'll save you from having to ask someone else. So the first thing I'll do is put on my hair covering. So since I have a lot of hair, I'll put on this. It's called a bouffant. And you want to be sure to tuck your hair in so nothing is left hanging out. I'm an interventional radiologist, so we'll just pretend I'm doing a case without lead. So an example of that would be like a port removal. And in that case, if I wasn't using any fluoroscopy or live x-ray, I would still use some eye protection. So that's an example of that here. These are some disposable, I think acrylic glasses to prevent me from getting any splash contamination in my eyes. Then I'm going to put on my surgical mask. This one has a little adhesive to prevent the air that you breathe out from fogging up your glasses. So you just want to make sure that's tightened around your nose. And then it'll look like that. So kind of one up above and one below to secure that. So in the operating room, you might have somebody like a surgical tech actually holding the gown out for you to just put your arms in like so, but I'll show you how to do it yourself. So I open this little package like a present, and what you find on the inside is this seam that you find is the neck. So this is the inside of the gown, which is not sterile. The other side facing you will be sterile. So you grab the inside of the sleeves and shimmy it on without touching anything. And Lorenzo's gonna secure the top of my gown, which has a little Velcro strip, and he's also gonna tie around my waist on the inside of the gown, and that's not sterile. As he does that, then I come to my sterile gloves. You can see that they're labeled right and left. So I can open those up. And you see I still have my sleeves over my hands. So picking up the right glove, I make a little puckered motion with my hand and slip my hand in so as to not fold the glove. And then I slide that onto my hand and leave it folded like that. Then I take my right hand and grab my left glove and slide the hand out, slide the hand in, without contaminating the right glove. And then I fold that piece over so that it covers the sleeve of the gown. Now I take my left hand and do the same thing on the right side. And I'm totally sterile. The last step to cover my back is you take this tab and separate 2 strands in the front of the gown. And I'll hand this card to Lorenzo. It's no longer sterile. And I spin around until I have these 2 strands, one wrapping around my back. And I'll tie this in a bow. And I'm ready to go.